Today we are going to see a design thinking video, and this design thinking video is on debate session. Hope you might have seen our previous video on debate session. Today I represent Mr. Benjamin Thomas and Mr. Prasanna Arasal. They are from final years of the BPT college, and they are going to debate on the trigger point release and the muscle energy technique. These two terms are new to some other people, but it is an older technique which will carry forward a greater experience in the hands-on technique. Hope this video will be useful, and this debate will be quite interesting on which one will stand a little bit long. Thank you.
Hello, I am Benjamin Thomas, pursuing my 4th year of Physiotherapy in SNS College of Physiotherapy in Coimbatore. Now I am going to debate the topic of MET, muscle energy technique, in this debate.
Hi, myself Prasanna. I am studying final year physiotherapy. Today I am going to talk a debate about the trigger point release therapy.
MET, muscle energy technique. It is one type of manual therapy which we use in physiotherapy to treat the patient with muscle tension, joint instability or joint stiffness with postural imbalance. We can use in these patients.
Coming to trigger point release therapy, we are treating a muscle taut band. By releasing it, we can improve the functional activity and we are improving a range of motion. This is the main thing which involves in the trigger point release therapy.
Yes. Now let's discuss about the technique. The technique which is used in MET is, first we give the isometric contraction to the muscle, which by giving a passive resistance by the therapist and the active contraction of muscle by the patient, where we hold the contraction of the muscle for 5 to 10 seconds. Later that we finish it with the 30 to 20 seconds of stretching. It can be either stimulated for 5 to 8 times of MET for a patient to relieve the muscle tension.
And then in trigger point release therapy, we are using some technique like ischemic compression. By this technique, we are relieving and releasing the taut band in the muscle. By releasing it, the patient will attain the more range of motion and flexibility due to these techniques. And this, it is the most important technique and higher efficient technique to release a trigger point. In this, we are following some certain criteria like reducing a pain, and after that, we are going to release the taut band. Then we are provide stretching and then a strengthening, and later we are going to provide a functional ability to the particular muscle. These are the steps involved in the trigger point release therapy.
Okay. When we compare trigger point release with the MET, muscle energy technique, we can conclude that trigger point release is giving the short-term relief of pain, where we give the stimulus or trigger point release, where we release the knot of the muscle in a particular position of the particular muscle. It gives a short-term pain relief, and some patient may feel difficult to tolerate the amount of pain the trigger point release gives. What do you think about it?
Yeah, coming to this point, see, a good therapist will provide a tolerable amount of pressure to release the trigger point release. See, providing a huge amount of pressure on it, it is not the thing that by providing a high amount of energy or pressure leads to the high amount of release or relieving those stuffs. If we are providing a normal or gentle pressure on it, it also works out. That is the main point in this trigger point release therapy. And we are also treating a root cause, not only in a particular aspect. We are also treating a root cause, and also which is connected to every kind of classificational or radiating pain aspects.
Yes. When the pain is only based on the origin of muscle, the trigger point therapy works. But when the root cause, due to any postural imbalance, due to any daily regular activities or muscle weakness, here comes the role of MET. Due to any kind of this root cause, the muscle gets weaker, or it gets lengthened, or it gets taut or contracted. Whereby giving the MET techniques, muscle energy technique, where we are going to strengthen the muscle which is got lengthened, and at the relaxation phase we are going to lengthen it. which gives a more predominant confidence to the patient, where the patient can only do the isometric contraction, this active process, where they can only control the process of pain. Until the limit of the tolerance of the patient, they can control the movement. So I think it is more effective than compared to the trigger point release.
Yeah, coming to trigger point release, we can provide this treatment with our hands to the patients, and we do not depend upon any kind of modalities and like waveforms, etc. And trigger point release is the one of the most effective one to treat various problems like one-side headache, and also by treating a trigger point release, especially for the diaphragm release, we can provide good results in hiccups control.
Yes, it's one type of release which is used in trigger point. Yes, I do agree with that. But giving the same kind of isometric exercise for the neck extensors and the stretching out it is, which gives a significant result in relieving the headache. And MET also a manual therapy.
But we can do magics with these kind of releases. We also use these kind of techniques in a lot in the sports physiotherapy. It is the main thing which we want to conclude, that the sports physiotherapy needs a lot of trigger point release aspects. This is the most important thing why we are using a trigger point release in any situation in the sports therapy and the sports rehabilitation.
Okay. When it comes to daily life physiotherapy or orthopedic physiotherapy, MET plays a main role in treating patients with musculoskeletal disorders, where we can treat n number of diseases with the MET compared with the trigger point release. Thank you.
Yeah, now we have seen this debate session, and this debate was really a fiercing thing. Both Benjamin Thomas and Resonance's the way of a statement was very much useful for the physiotherapy field. Now we are in the state of the conclusion, which will stand a greater need, MET or trigger point release. As of my understanding and the research understanding, this MET plays a greater role compared to the trigger point release. So in this conclusion, we should not conclude that TRP is very much less and MET is greater. Both things are good in the standing field. But if we are taking this MET a little bit longer, MET works a little bit functioning good compared with the TRP. Hence, MET plays a greater role in the physiotherapy field of the advancement. Hence, this video is concluding here, but the advancement and the information and the research will not be concluded here. It will go on for the next video. Thank you.